Prevention. It's a big word in the world of healthcare, preventing obesity, preventing alcoholism, preventing diabetes, preventing drug addiction, and on and on and on. Officials at Gundersen are working on getting a handle on prevention through asking questions that you might not think actually pertain to your health. Things like living conditions, access to healthy food, transportation, and more. Well, joining us this morning to talk about that is Dr. Kim Breidenbach. Good morning, Kim.
Good morning.
So, Kim, when you're visiting with a patient and trying to assert a diagnosis, you're asking these seemingly non-healthcare related questions of patients, like, how is your transportation? Why? Why would you do that?
Well, we know now that only about 20% of a person's health is determined by their genetics and about the health care that they receive. And the other 80% is influenced by the things that are happening in their daily life. And that includes their diet and their exercise, but it also includes things like, do they have access to healthy foods? Do they have reliable transportation, reliable housing, and how easy is it for them to pay their bills? And we call those things social determinants or social drivers of health. They can have a negative or a positive impact on patients' health. And by asking about them, we can help to understand all of the factors that are really playing into a patient's health or their illnesses.
So what are you hoping to find by asking these sorts of questions?
The first thing we're hoping to do is understand our patients better, because if we know the details that are going on in their lives, we can partner with them and take better care of them. We're also hoping to find ways that we can ease some of those burdens. So for example, if we know a patient has difficulty with transportation, we could offer them more video visits, or we could offer appointments scheduled together on the same day to minimize the number of trips they need to make. We're also looking for opportunities to connect them with resources that are in the community that might help them to decrease the burden of some of their difficulties. For example, if they're having trouble paying bills, we might connect them with a program that helps to support the cost of their heating bill during the winter.
So by asking these questions of your patients, are you hoping that will somehow prevent things like obesity, diabetes, etc.?
Yeah, so you can imagine that if you are living a life where you're constantly worried about food or constantly worried about paying your bills, that's a stressful life. And we know that stress has a very significant impact on the physiology in the body. It changes your cells, changes your hormones, it changes the chemicals that are happening in your brain, and that chronic daily stress creates disease or contributes to disease or poorer health. So we think that if we can help people to have a little bit less stress in their daily life by helping to support those social needs, that we can then prevent or decrease the burden of their diseases.
All right, well, Kim, I hope this helps patients understand that every question asked is important for their health. Thank you so much for joining us this morning.
You're welcome. Thank you.
Well, to learn more about your health at Gundersen, check this story out on our News 19 mobile app and online at wxow.com.